You wake up in the morning. You sit up slowly, swing your legs over the side of the bed, and the moment your feet touch the floor, you feel it. That strange, uncomfortable sensation. Maybe it's a dull numbness. Maybe it's a tingling, like tiny sparks moving through your toes. Or maybe it's that burning feeling that nobody around you seems to understand, because from the outside, your feet look completely fine. If you're over 70 and you know exactly what I'm describing, this video was made for you. Today, I'm going to show you 2 simple exercises you can do entirely from a chair. No standing required. No equipment. No complicated routines. These 2 movements are designed to help wake up the circulation in your lower legs, gently stimulate the nerves in your feet, and ease the stiffness that makes the first few steps of the day feel like walking through wet cement. Stay with me until the end, because I'll also give you a short bonus foot awakening routine that takes less than 2 minutes and can be done right before bed. Before we get into the exercises, I want to take 2 minutes to explain what's actually happening in your body, because once you understand the why, these movements will make a lot more sense. Peripheral neuropathy, the medical term for nerve damage or dysfunction in the hands, feet, and legs, affects a significant portion of people over the age of 60. But age alone doesn't cause it. What age does is set the stage for it. Here's what changes as we get older. First, circulation slows down. The blood vessels that carry oxygen and nutrients to the nerves in your feet become less efficient over time. They lose some of their elasticity. Blood doesn't pump through as forcefully. And your feet, being the farthest point from your heart, are the first to feel that reduced flow. Second, muscle activity decreases. The muscles in your calves, your ankles, your feet, they act as a kind of pump for your circulatory system. Every time those muscles contract, they squeeze the veins and push blood back upward toward the heart. When those muscles stop moving, which happens a lot when we're spending more time sitting, that pumping action slows almost completely. Third, nerves receive less stimulation. Nerves need to be used to stay healthy. When we reduce our movement and spend more time sedentary, the nerve pathways to our feet get less traffic. Over time, they can become sluggish. Some signals get delayed. Others feel distorted, which is where the tingling, burning, and numbness come from. And finally, prolonged sitting makes everything worse. When you sit for long periods, blood pools in the lower legs. Fluid builds up. Circulation becomes sluggish. The feet grow stiff. And when you finally stand up, that transition can feel jarring, painful, or unsteady. Now here's the most important thing I can tell you today. We are not trying to cure neuropathy with 2 chair exercises. That's not the goal. The goal is to improve blood flow, reactivate the muscles that support circulation, and give the nerves in your lower body more of the daily stimulation they need to function well. Not to reverse damage, but to support what's still working. And in many cases, that support alone makes a meaningful difference in how your feet and legs feel day to day. Before we get to the exercises, I want to address 4 mistakes that are extremely common, and that may be preventing you from seeing any improvement. Mistake number 1, believing that rest is always the answer. When your feet hurt, the instinct is to take the weight off them. Sit down. Put them up. Avoid anything that might make it worse. And sometimes rest is exactly what's needed. But chronic, prolonged rest, doing very little movement every day, can actually make neuropathy symptoms worse over time by further reducing circulation and nerve stimulation. Gentle, consistent movement is often more healing than stillness. Mistake number 2, avoiding movement because of discomfort. Many people stop exercising because the tingling or numbness makes movement feel unsafe or unpleasant. This is completely understandable. But low-intensity chair-based movement, the kind we're doing today, is specifically designed to work within those limitations. You don't need to push through pain. You just need to keep things moving. Mistake number 3, only exercising once or twice a week. Circulation and nerve health respond to frequency, not intensity. A gentle 5-minute movement session done every single day will do more for your feet and legs than a longer session done twice a week and then forgotten. Consistency is what creates change at this level. Mistake number 4, ignoring ankle mobility. The ankle is one of the most important joints in your body for circulation and balance, and it's one of the most neglected. When ankle mobility decreases, the muscles around it become less active, and the pumping mechanism that pushes blood up through the leg loses much of its power. A stiff ankle contributes directly to cold feet, poor circulation, and increased fall risk. That's exactly why the first exercise we're doing today targets that joint specifically. The first exercise is called seated ankle pumps, and it is one of the most effective, evidence-supported movements you can do for lower leg circulation. Here's why it works. Your calf muscles, the muscles at the back of your lower leg, are sometimes called the body's second heart. Every time they contract, they squeeze the deep veins in your leg and push blood back upward toward your heart. When you sit still for long periods, that pumping stops. Blood and fluid settle downward. Your feet become heavier, colder, and more prone to tingling. Ankle pumps restart that mechanism. Sit upright in your chair, not slumped, not rigid, just comfortably tall. Both feet flat on the floor, about hip-width apart. Rest your hands gently on your thighs. Take a slow breath in and let it out. Good. Now here's the movement. Starting with your heels on the floor, you're going to pull your toes up toward your shins as far as is comfortable. Hold that position for just a moment. You should feel a gentle stretch through the front of your ankle and a light contraction at the back of your lower leg. Then reverse the motion, point your toes downward, pressing the balls of your feet toward the floor while your heels lift slightly. Hold for a moment there too. That's one pump. Pull up. Point down. Now let's do this together. Go slowly. This is not a race. The goal is a full range of motion through the ankle, not speed. Pull up, hold, point down, hold. Good. Pull up, hold, point down, hold. Keep breathing normally. Up, hold, down, hold. Let your shoulders stay relaxed. Up, hold, down, hold. Feel the calves working on that downward movement. Up, hold, down, hold. Excellent. Keep going at your own pace. And gently rest. Now notice how your lower legs feel compared to when you started. Many people report a warmth, a slight tingling of a different kind, not the uncomfortable kind, but the sensation of blood beginning to move again. A few things to watch for. Don't rush. Moving too quickly means you're using momentum rather than muscle. You want deliberate, controlled movement through the full range. Don't hold your breath. It's a very common habit during exercise, especially when concentrating. Keep breathing gently throughout. And don't lean backward to compensate. Stay upright. The movement is happening at the ankle, not the whole body. Aim for this exercise twice a day, a set of 20 to 30 pumps each time. Morning and afternoon are ideal. The second exercise is called seated marching, and while it looks simple, because it is, what it's doing internally is significant. Where ankle pumps targeted the lower leg specifically, seated marching recruits the larger muscle groups of the thighs and hips. These are some of the biggest muscles in your body, and when they contract and release in a rhythmic pattern, they drive a substantial increase in blood flow throughout the entire lower body. They also work the hip flexors, muscles that tend to become tight and shorten from extended sitting, which play a direct role in how stable and confident you feel when you walk. There's another benefit that often goes unmentioned. Seated marching requires your core muscles to stay engaged in order to keep you upright through alternating movement. That low-level, ongoing core activation is part of what supports balance over time. Same starting position as before, sit upright, feet flat, hands resting on your thighs or gently gripping the sides of the seat if you prefer that for stability. Chin level, shoulders relaxed. The movement, you are simply going to lift one knee upward, just a few inches off the seat, then lower it back down, and alternate to the other side. Just like marching in place, but seated. The motion should come from the hip, not from leaning sideways or rocking the upper body. Let's begin together. Right knee up and down. Left knee up and down. Right, down. Left, down. Find your rhythm. Right, down. Left, down. Keep your back away from the chair back if you can. Right, down. Left, down. Breathe in through the nose, out through the mouth. Right, down. Left, down. Good. And rest both feet flat on the floor. Take a breath. Feel the warmth that's moved into your hips and thighs? That's circulation doing its job. A few modifications worth knowing. If lifting the knee fully is uncomfortable, a smaller lift is completely fine. Even a 1-inch lift still activates the hip flexor and drives blood flow. It's the contraction that matters, not how high the knee goes. If fatigue sets in quickly, take a rest break every 30 seconds. 10 lifts, pause, 10 more. Over time, as the muscles grow stronger, the rest breaks will become shorter and eventually unnecessary. If your balance feels uncertain even while seated, hold the sides of the chair lightly throughout. Aim for this once or twice a day as well. 20 repetitions per leg is a good starting target. Over 2 to 3 weeks, you can work up to 40 or 50 per session. Here's the bonus routine I mentioned at the beginning, and this one takes less than 2 minutes. It's ideal to do right after the ankle pumps and marching, or on its own before bed. These 3 small movements specifically target the intrinsic muscles of the foot, the tiny muscles that live inside the foot itself, not just the leg. These muscles are responsible for your sense of where your foot is in space, your grip on the ground when walking, and the fine motor balance adjustments that keep you steady. In people with neuropathy, these muscles often become underactive because the nerve signals reaching them are weakened. The goal here is simple: stimulate them. Wake them up. Step 1. Toe spreads. With your feet flat on the floor, try to spread all 5 toes apart as far as they'll go, like you're trying to widen the front of your foot. Hold for 3 seconds, then release. Repeat 5 to 10 times. If your toes don't spread much at first, that's perfectly normal. The intention is what activates the muscles, even when visible movement is small. Step 2. Toe curls. Now curl all your toes downward, as if you're trying to grip the floor with them. Hold for 3 seconds, then release fully. Repeat 5 to 10 times. You should feel a contraction through the arch of the foot. Step 3. Seated heel raises. With your toes staying flat on the floor, simply lift both heels off the ground together. Rise up onto the balls of your feet, hold for 2 or 3 seconds, then lower back down slowly. Repeat 10 times. This targets the lower calf and the muscles along the inner ankle, an area that often weakens quietly before anyone notices. Together, these 3 movements take under 2 minutes and they make a surprising difference in how awake and responsive your feet feel after doing them consistently. Now let me put this all together into a daily routine that you can realistically follow, because as I mentioned earlier, consistency matters far more than intensity here. Right after getting up, before you do anything else, sit at the edge of your bed or in your favorite chair and complete 30 ankle pumps, 20 marches per leg, and the full bonus foot awakening routine. This takes approximately 5 to 7 minutes. It prepares your feet and legs for the movement demands of the day. Midday or early afternoon, especially if you've been sitting for a while, do another round of ankle pumps and a minute of marching. This doesn't need to be a full session. Even 15 pumps and 10 marches per side is enough to reactivate circulation and keep the muscles from going completely dormant during the afternoon hours. Before bed, do a gentle set of ankle pumps, slowly, softly, and the toe spread and curl exercises. This helps reduce any fluid that's pooled in the lower legs during the day and supports better circulation overnight. The most important principle behind all of this is one that applies to almost everything in health after 70: consistency beats intensity. You don't need to push yourself. You don't need to feel exhausted. You just need to show up for your feet a little bit every single day. I want to take a moment here to say this because I think it is genuinely important. These exercises are gentle, low risk, and appropriate for the vast majority of seniors dealing with neuropathy symptoms. But there are certain signs that should always be brought to a medical professional's attention promptly. Please speak with your doctor if you notice any of the following. If your symptoms suddenly worsen, a sharp increase in numbness, burning, or pain that appears quickly rather than gradually, that warrants evaluation. If you develop severe or worsening pain in the legs or feet that doesn't respond to position changes or rest. If you have a wound, cut, or sore on your foot that isn't healing. Reduced sensation can mean that injuries go unnoticed, and poor circulation can mean they don't heal properly. This is especially important for anyone managing diabetes. If you notice significant new weakness in your feet or ankles, tripping more easily, difficulty lifting the front of the foot when walking. If your balance problems feel like they're escalating, particularly if you've had any falls or near falls recently. None of this is meant to frighten you. The vast majority of people doing these exercises will feel better, not worse. But exercises are a complement to good medical care, not a replacement for it. Your doctor should know what symptoms you're managing, and these conversations are worth having. Let's recap what you learned today. You now have 2 chair exercises, seated ankle pumps and seated marching, that work together to improve circulation in the lower legs, stimulate the muscles that support nerve health, and help counteract the daily effects of prolonged sitting. You have a bonus foot awakening routine that takes less than 2 minutes. And you have a simple morning, afternoon, and evening framework that takes the guesswork out of when and how much to do. None of this is complicated. But done consistently, over days and weeks, the cumulative effect on how your feet and legs feel can be genuinely meaningful. If you made it all the way to the end of this video, I want you to do one thing right now: leave a comment below that says "I'm starting today." It takes 2 seconds and it creates accountability. It tells your brain that this wasn't just something you watched, it's something you're beginning. And if you'd like more exercises like these, focused specifically on circulation, balance, nerve health, and mobility for seniors, subscribe to this channel and turn on the notification bell so you don't miss what comes next. Your feet have carried you a long way. It's time to take care of them.